Hey, what's up, Internet? I'm in Vancouver at the Interface 2014 Digital Healthcare Summit with my old buddy from the Internet, Michael Ferguson.
Hey.
How's it going, man?
Oh, it's all good, man.
Cool.
It's good to see you.
Thank you. Thank you. Good to be seen. Nice to be in Vancouver. And though we're about all you can see, because if you take a look out the windows here, it is an overcast Vancouver fall day.
Yeah, somewhere out there are some mountains, but
I could just sit here and watch these seaplanes take off and land all day long.
yeah, we're in a good spot.
In fact, maybe don't tell my benefactors, but I've probably spent a good portion of the day sitting there staring at planes taking off.
I thought you were working really hard the whole time. That's what I saw.
Awesome. Well, I know you've been working really hard. You are the CEO of Ayogo.
I am.
Medical app startup.
That's what we do, yep.
Why don't you tell us a little bit more?
Sure. Well, we use game psychology and social patterning effects to help patients with chronic diseases manage their care plans more effectively.
Awesome. Give me like a use case. So like my kid's got diabetes.
Sure. Well, we do a fair amount of work with kids as well as with adults, so why don't we talk about kids? Kids are good.
Sure.
So your kid's got to manage their blood sugar. They have to check, report on it regularly, put it in a report for you. They also need to manage their diet and their exercise. But it's very hard to do that because they're not really motivated minute by minute. What you do right now actually has a very little impact on your health. It's the cumulative effect. So actually helping people to manage their motivation is a pretty challenging thing to do.
And we know like the gamification of everything, right? It totally works no matter what the age, like, you know, whether it's air miles or Visa reward points or, you know,
That's right.
unlock a badge on this thing or that thing. So you've been able to utilize this for people taking care of their own health?
That's right. Now, something really important to say about that is that points and badges are like page numbers and chapter headings are to literature. It doesn't actually tell you anything about the underlying story. So you actually have to make a system that is engaging. It has to have a sense of agency, challenge, uncertainty, rules, and objectives. These are actually the really important aspects of good quality game design, and our business is applying these principles to healthcare.
So a lot of people talk about, you know, gamification, this and that, and you're telling me, you know, it's a lot more than it's on the surface. It goes a lot deeper in our case.
Yes.
And so have you guys like rolled out, have you built some kind of healthcare based kind of gamified tools that people are not just using on the surface level, but have really dug down deep into and have started to become like, you know, level 99 diabetes caretaker master or something like that?
Well, sure. Yeah, we actually have had a whole, so one thing to preface my comments with is that all of our customers are big healthcare organizations and they're highly regulated. So we have to be careful about what we say publicly about
Sure.
who we've done the work for and what we've done exactly, but I can say that
Feel free to lie about the names as long as the stories stay the same.
right.
Yeah.
So we are working with a variety of large healthcare organizations in the US.
Acme Healthcare.
Acme Healthcare has seen some really substantial improvements in outcomes for their patients using our system. Patients are more engaged, they lose more weight, their composition of their diet has changed to make them healthier, and those changes are sustained over longer periods of time using our gamification framework.
You know, as a guy who uses the internet a lot, like Flickr, you know, Flickr's for posting
yeah.
photos, but there's a lot of gamified elements kind of to Flickr that
Yes.
make you kind of want to keep using it. And one
Absolutely.
thing that they've done awesome is that they've made it like super simple on the surface, but here a decade later, I'm still finding functions I've never used before. I'm kind of finding ways to kind of
Yeah.
combine and tweak things. So are you able to do this as well, where you're kind of able to keep it simple, draw folks in when they're not used to recording blood sugar, but also they're really going down to the depths of getting themselves and their friends better?
Yeah, I mean, you put your finger on a really important principle, which is discoverability. So I can give you the rule, for example, I can give you the rule book for ice hockey. But that doesn't tell you anything about going where the puck is going, not where it is. That's
Sure.
a rule you can only discover by playing,
Yeah.
right? Only by using it.
Skate to where the puck is going to be.
That's right.
Right.
So these rules that are only discoverable through the course of play are critical to flow and mastery and feeling really engaged. So yeah, that's precisely it.
Cool. Well, I've been rubbing shoulders with this guy in the kind of internet business world for a long time now. It's always a pleasure. He's got a beautiful family, and there's a lot that makes up this man. So Michael Ferguson, Ayogo, thanks for taking a little time here with me.
It's really
Keep
my
your stick
pleasure.
on the ice.
Absolutely.
All right, over and out from the Interface Digital Healthcare Conference at the
Peace.
Vancouver Convention Center.